where we come in is where the counseling aspect is, because we have seen that a lot of our clients have a background or an experience of childhood sexual abuse or even dysfunctional families around them. Once the substance abuse is started initially as an experimentation, it becomes an addiction and a solution for their emotional issues. See, in addiction, the core issue is always an emotional issue or an inability or a difficulty in dealing with one's emotions. That also adds up to the sexual aspect of it, wherein one's rapport is built with the client, and the client, whether it's a male or a female, becomes comfortable to converse and to share about their sexual aspects and sexual activities and their experiences. Because, as you rightly said and as you elaborated, the inhibitions drop. When the inhibitions drop, what happens is that there is a lot of indulgence in sexual activities, which, when the person looks at it in retrospect after they sober up, they feel and experience a lot of guilt and shame associated with the same. Now, this guilt and shame can be self inflicted, or it can be brought on by family around them or society around them also. So, that emotional unmanageability is what we help the person to deal with through counseling techniques, through assuming responsibility by writing about or journaling these experiences, and also, most importantly, with the help of meditative techniques, which help them to deal with a lot of their suppressed and repressed emotions, which can surface and which can be shared in a very safe space that is provided to them with people who have already experienced what they might be experienced at that point of time and have dealt with their own issues. So the experiential counselors around them also act as motivation factors or points in helping them to get beyond the guilt and shame around the sexuality, sex and sexuality, or their sexual experiences that they go through. And if there is any pathology involved, then we have definitely approach experts like you and we encourage them to seek help. See, this is a topic which is rarely spoken about and rarely addressed, even in treatment facilities, unfortunately. We are probably the only facility that addresses it at length, not only with the person who is addicted to the substance, but also with the family, because the family or the spouse is an integral part of that person's life. And sexual function, sexual desire, sexuality, the act of sex, and the sexual relationship is a very important part of any kind of relating with one's partner or spouse. Which you rightly said in some of your earlier questions, communication is a key factor. And we encourage the family to enhance their communicative skills with each other, not only related to addiction and emotions, but also where their sexual desires and sexual experiences are concerned.